Monagarala, also known as Wellassa, is the second largest district in the beautiful island nation of Sri Lanka, rich with exquisite antiquity, scenic landscapes and luxuriant farming lands. Unfortunately, this prosperous terrain is riddled with some misfortunes of poverty, illiteracy as well as the dreaded chronic kidney disease. There, a courageous mother, Pinsiri, and her differently abled, sight-impaired son Somapala live in a village which nestles near the attractive blue water of Muthukandiya Reservoir. Their life was shattered when Somapala was started on hemodialysis due to end-stage renal disease. The mother and son had to travel a long way to Monagarala, and also obtaining hemodialysis was irregular because the number of machines was limited. Pinsiri lost all of her earnings. Dr. Udana Ratnapala, consultant nephrologist who assumed duties in 2019 as the only nephrologist serving the whole of the Uva province, inclusive of both Padulla and Monagarala districts with 1.3 million people, was desperate to find answers and solutions.
I noted that chronic kidney disease in Monagarala was extremely high, and a recent study has already demonstrated that at least one member of 1 in 10 households in Monagarala had chronic kidney disease. We had major problems to conquer. First of all, the number of bed strength in the hemodialysis unit was largely inadequate. We had to put an age ceiling of care, and we could provide only twice a week dialysis and nothing more than that. Further, there was no clinic space for us. We had to run our outpatients clinics inside the dialysis unit. There was no space for storage of dialysis fluids as well as no storage for reverse osmosis plant. So all those things were stuck and crowded in the dialysis unit. So the cross-contamination was extremely high. Added to that, there was no procedure room also. So we had to carry out our procedures like line insertions within the dialysis unit. So the line sepsis rates were very high and the dialysis was frequently interrupted. And the travel expenses was quite high since Monagarala is a large district because the travel distance was too high. So patients frequently defaulted hemodialysis. We needed more space, we needed refurbishment of our unit, but the Ministry of Health also couldn't help us because of the COVID and the economic crisis in the country.
Based on the concept of empowering local strength to conquer local weakness, Dr. Udana Ratnapala, hand in hand with Dr. Nuwan Premavardhana, consultant physician, founded the non-profit, non-governmental organization called CKD Prevention Task Force Monagarala. All of the pertinent local authorities, well-wishers, community leaders, hospital administrators, the local strength was centered on the noble notion of fighting CKD, the local weakness.
Having worked in different parts of the country, including the endemic areas of CKD, we were very well aware of the lapses in kidney care and adverse experience faced by the patients with chronic kidney disease. Therefore, we worked really hard to establish this organization to promote CKD prevention, and also with the vision of uplifting the kidney care within this rural community.
After many public awareness campaigns and CKD screening programs being conducted, the task force capitalized on expanding the current hemodialysis unit and building a new nephrology facility. In the midst of COVID-19, the epidemic and economic crisis, the necessary funds were raised primarily through the donations of people living in Monagarala. Many volunteers came forward. After months of facing numerous hardships, the effort reached its pinnacle when the new nephrology facility and expanded hemodialysis unit was declared open on the 25th of June 2023.
This project was great success. It was entirely funded by public charity, mainly local well-wishers, estimating 16 million Sri Lankan rupees. Our new unit consists of 10 hemodialysis machines, outpatient clinic facilities, storage facilities, procedure room, and a space for reverse osmosis plant.
Even though free hemodialysis services are provided, their poverty resulted in malnutrition, poor mental health and early death. Hence, based on a novel concept, the Chronic Kidney Disease Welfare Shop was launched by establishing a free of rental retail facility, enabling them to sell their household products.
රගර් රෝගී සුබසාධන වෙළඳසැලේ මාසික ආදායම යන විට ලක්ෂ 2 සීමාවට ආසන්න වෙලා තියෙනවා. මේ ප්‍රධාන වශයෙන් අලෙවි කරනු ලබන්නේ රෝගීන්ගේ නිෂ්පාදන අපගේ කාර්ය මණ්ඩලය සහ රෝගීන් බැලීමට එන අමුත්තන් පොඩ්ඩක් වශයෙන් මෙම අලෙවිසැලෙන් ද්‍රව්‍ය මිලදී ගැනීමට පුරුදු වෙලා ඉන්නවා. රෝගී යම්කිසි රෝගියෙක් රුධිරකාන්තුකරණය කරන අවස්ථාවේදී පැහැදර කාල සීමාවක් පමණ ගත කරන නිසා ඔවුන්ගේ ආශ්‍රිතයින් හෝ රුධිරකාන්තුකරණයෙන් පසු රෝගීන් හෝ මෙම කාර්යයේ නිරත වෙලා ඉන්නවා.
ඔය කුලී වැටලත් මයි පුතා තනියෙන් දාලා වැඩට ගිහිල්ලා බස් දාත් හොයාගෙන තමයි හුඟක් අමාරුවෙන් ගියේ. දැන් එහෙම නෑ. ගස් කුලී දීලා පොල් ටිකක් අහරින් මේ හොයාගත්තොම ඒ ටික අරන් ගිහිල්ලා මිල කරලා එදා දවස හොඳට ගෙවා ගන්නවා. ඇත්තටම තරමාතුරුන් අනන්ත වාර්ගනම් බුදුවා ලැබේවා, පින්සිද්ද වේවා, නිරෝගී සම්පත්තිය ලැබේවා. මං ගොඩක් කියන්න බැරි තරම් සතුටු වෙනවා අපේ තරමාතුරුන්.
In a terrain where beauty challenges poverty, this emotive story of a mother and a son portrays the indomitable determination and kindness could mitigate the suffering of fellow humans. Hence, local strengths conquered local weakness, giving a new lifeline to Wellassa.